Hello all. Welcome to the Unlocking Advanced Pediatrics, an exclusive webinar designed to enrich your knowledge and expertise in the field of pediatrics. We are honored to have you all with us today. Before we begin, allow me to introduce you all to our esteemed speaker, Dr. Padmasani Venkat Ramanan, a distinguished professor of pediatrics at the prestigious Sri Ramachandra Institute of Higher Education and Research. With her extensive experience and profound insights, she has significantly contributed to the field of pediatrics and medical education. Today, Dr. Ramanan will guide us through two critical topics from her renowned book, BRS Pediatrics, first South Indian edition. She will dwell into two topics, which is hematuria from chapter 11 and assessment of nutrition class status from chapter 21. In addition to these enlightening topics, we'll also discuss how artificial intelligence can revolutionize your learning experience, helping you to summarize content, take detailed notes, collaborate seamlessly, and test your knowledge through interactive Q&As. We encourage you to actively participate and ask questions throughout the session and send them to us on chat so that we'll be able to answer them happily. Without further ado, let's dive into the world of advanced pediatrics. I request Dr. Padma to join us. All join us to welcome Dr. Padmasani Venkat Ramanan. Now, ma'am, it's over to you now. I'm sharing a screen right to you.
Thank you so much for those kind words of introduction, Mr. Shukla. And I thank Wolters Kluwer for this opportunity to talk about my new book. Is the screen visible?
Yes, ma'am.
Yes, ma'am. Yeah. So I'm here to talk about this new book in pediatrics, the BRS Pediatrics First South Asian edition. It is an exam preparatory manual for undergraduate students. I'm currently professor of pediatrics at SRIHER, Chennai. I completed my MBBS and MD from Maulana Azad Medical College in New Delhi. And I have been a teacher and examiner. Why is my slide moving? I am not moving it. Is somebody moving the slide?
No, ma'am, it's still there. No, you can put it on the presentation mode also, if you want.
Yeah. Okay. I don't know if somebody's controlling it, but please let me move the slides according to my pace of talk.
Sure, ma'am, sure.
Yeah. This book has come out of my 25 years of experience as a teacher and as an examiner for undergraduate and postgraduate students in pediatrics. What is new about this book? Many of you will be aware that the undergraduate curriculum in our country was extensively revised a few years ago. The new CBME curriculum was introduced in 2019. Competency-based medical education curriculum is outcome-driven, and the focus is not so much on acquiring knowledge, it is on acquiring competencies. So the CBME curriculum is interested in what the IMG should be able to perform at the end of his or her training. By IMG, I mean an Indian medical graduate. This new CBME curriculum conforms to global trends, and along with the change in curriculum, the evaluation pattern is also likely to change. So some of the changes that are expected in the evaluation pattern, we still don't know for sure when the changes will come into effect. But even now, all the PG entrance exams are MCQ based. It is possible that the final MBBS exam pattern will also change. We won't have long answers and short answers. It is likely to become MCQ based. And regarding these MCQs, it is expected that only some of them will be MCQs which test your ability to recall facts. Most of the MCQs will be testing the ability of the student to apply the concepts in a given case scenario. And step 1 of the national exit exam is likely to be evaluating 6 clinical subjects in a span of 3 days. So given the time constraints and the pressure before an exam, revising an entire textbook is not feasible. So the need for a book which helps in rapid revision of core concepts, has long been felt. With these aspects in mind, this new book, Exam Preparatory Manual for Undergraduates, has been written. It is a modification of the International Board Review Series in Pediatrics. The Board Review Series in Pediatrics has been widely used by students for preparing for the USMLE Step 2 exams. This has been modified to meet the needs of the Indian students. The essential information in textbooks has been distilled and it has been presented in a student-friendly format. There are numerous figures, flow diagrams, and over 100 tables. There are very few sentences or paragraphs in the book. And the focus is entirely on the high-yield exam relevant points. I have gone through the previous 10 years question papers for NEET PG entrance exams and the INISET exams, and keeping in mind the kind of case-based questions which are typically asked, the content of these chapters has been revised. There is concise description with clinical correlation, and at the end of each chapter, we have review questions. Overall, the book has over 400 MCQs, and at the end of the book, in addition to the end of the chapter questions, at the end of the book, there is a comprehensive exam, which really helps the student to get a feel of the final exam that they will be taking. Just to give you some examples of the student-friendly formatting of the book, every student, medical graduate, is expected to know how the baby grows in the first few years of life. So without wasting pages on detailed explanation, we have rule of the thumb for expected increase in weight. From birth to 2 years, what is the expected increase? 2 weeks to 3 months, 30 grams per day. 3 months to 6 months, 20 grams per day. When does the birth weight double? 4 to 6 months. These are all very common MCQs. So if you look at the content of this one table, 1.1, 1.2, 1.3, almost 15 MCQs can be answered by just learning the information given in this table. Just as we have spoken about weight gain in early infancy, we also talk about weight gain from 2 years to puberty. And then we talk about the expected increase in height from 0 to 12 months, from 13 to 24 months, and from 2 years to adolescence. We don't talk about weight gain and height gain after adolescence because that is going to be an exponential increase in height and weight. All of you know about the adolescent growth spurt. Similarly, there is a rule of thumb for expected increase in head circumference. Another example I wanted to give was in the first chapter when we talk about failure to thrive. Very simple explanation of the 3 causes of failure to thrive. Inadequate calorie intake, what are the conditions which can cause that? Failure to thrive can be because of excessive calorie requirement, and there are examples of conditions which cause excessive calorie requirement. And then finally, failure to thrive can be because of inadequate calorie absorption. Again, we have given some examples of that condition. So this makes it very easy for the student to understand the concept of failure to thrive. As I said before, the entire book has been revised for alignment with the competencies defined in the CBME curriculum. So each chapter begins with the list of competencies covered in the chapter. So we have the NMC's CBME competency numbers here, and we have the competencies listed here. In addition to that, we have a chapter outline on what is going to be covered in this chapter. The content of the existing chapters has been revised because the epidemiology of diseases in India and South Asia is different from what it is in the West. Recent advances have been incorporated both in systemic pediatrics and in subspecialties. For example, in chapter 4 on neonatology, we have added topics: perinatal asphyxia, neonatal sepsis, perinatal infections, birth trauma, and the resuscitation algorithm has been revised. It is according to the National Resuscitation Program. In chapter 7 on infectious diseases, The focus is on those infections which are important to South Asia. All these topics are not there in the international edition of the BRS. We have described the vector-borne diseases, diphtheria, pertussis, tetanus, measles, mumps, rubella, and enteric fever. And chapter 10 on gastroenterology, we talk about the diagnostic tests for the common causes of chronic diarrhea in India and portal hypertension and hepatitis A. In chapter 20, we talk about the epidemiology of various emergency conditions in our country. And in addition to these chapters, which are there in the original book,
Ma'am,
we
just
have,
a sec. Ma'am, just
yes,
sorry to ma'am interrupt you. Ma'am, can you just reshare your screen? I think it's become static in between. Can you just reshare the screen again so you can share your PPT, please? It has become static.
you're not able to see the screen?
No, ma'am, we are. I think it has become static in between actually. So if you can reshare the screen. Thank you, ma'am.
So you want me to send you the PPT so that you can share it?
No, you can reshare the screen. I think it was good. I think it becomes static in between. So reshare the screen and I think it should be fine.
I will do that.
Thank you, ma'am.
So can you tell me from what point you want me to restart? So I was talking about the new tab topics which have been added under each of these chapters. And then we will move on to the 6 new chapters which have been added to the South Asian edition. They're not present in the previous edition. Next slide, please. Yeah. So these 6 new chapters, again, these are based upon the competencies listed in the NMC, CBME curriculum, nutritional requirements and malnutrition, micronutrients, vitamins and minerals, fluid and electrolytes, breastfeeding and complementary feeding, immunization, and medical legal issues in child health. Next slide, please. So beyond the CBME curriculum, there are some important topics that are included because we have seen that many of the PG entrance exams often have topics related to, often have MCQs related to these topics. We have pediatric orthopedics, pediatric ophthalmology, and pediatric dermatology. Next, please. So, as I said before, at the end of each chapter, there are review questions, and most of these review questions are case scenario based. So, they will help the student in self-assessment. You will be able to find out your level of comprehension. You will be able to identify your areas of weakness. And for each question, the answers the given, and there is a detailed explanation for the answers, so that just going through the questions and reading the answer itself is a learning process for students. Those who don't want to go through the chapters, not recommended, but this is also another way of gaining knowledge and preparing for your exams. Next slide. At the end of the book, the previous one. At the end of the book, in addition to the end of the chapter MCQs, at the end of the book, we have a whole question paper with MCQs, again with answers and explanation. This will also help you to practice. It is like a model exam for you. This will help you to practice for the pediatric exam whenever it happens. Next, please. Yeah. So to conclude, this is a rapid exam preparation manual. I want to emphasize that this is not a full comprehensive textbook. So students are strongly encouraged to go through a comprehensive textbook for detailed explanations. You won't have detailed explanation. You have very concise distilled information in this book. It's a very useful book for the current students for preparing for their PG entrance exam. And whenever it happens, I believe it will be a very good resource for preparing for the next step 1 exam. This book is also a useful companion during your pediatric clinical posting because so many of the concepts which you actually learn during your clinical postings are summarized in this book, and it will also be useful during internship. I will now take you through the 2 sample topics in the ebook. The features of the ebook, which is another, it's going to transform the way students learn. The LME, which is going to be elaborated by another person on this webinar. But I will just show you the 2 topics as an example on how the topics are presented in a very student-friendly manner for easy learning. So this is page 299 from the ebook. I don't know whether the letters are visible.
And can you just start sharing your screen now? I think this should be fine.
Yeah. Yeah. Shall I share my screen?
Sure, ma'am. Sure. Please go ahead, ma'am.
So can you all see this now?
Yes, ma'am. Quite visible. Thanks.
Okay.
Please go ahead, ma'am.
Yes. So just for an example, this chapter on hematuria, the definition of hematuria is given, definition of both gross and microscopic hematuria. And then there is a brief word about the epidemiology, just for students to know how common it is. There is the third section on the clinical significance. And then we have the evaluation of red colored urine illustrated in the form of a figure. So rather than reading a detailed explanation, the student just has to go through the figure to learn that red urine, you do a dipstick to see whether the red color is because of some other pigment, in which case the dipstick for blood will be negative. If the dipstick for blood is positive, then you do a microscopy. If there are no RBCs, then the red color is not because of red blood cells, it is because of hemoglobin or myoglobin. And if dipstick is positive and RBCs are present on microscopy, that is true hematuria. If RBC casts are present, then it is glomerulonephritis. If casts are absent, then the source of the RBCs is the lower urinary tract. There is also a brief explanation here, which tells you that if the RBCs are dysmorphic, it means they are coming from the glomerulus. If the RBCs are normal in morphology, then they are coming from the lower urinary tract. Next, I have to do that, is it? Next page. And then there is the differential diagnosis of hematuria listed under these categories. So again, this is one of those topics from which MCQs are very common in your PG entrance exams. The topics have been categorized as infectious causes, trauma, hematological causes, metabolic causes, structural causes, and glomerular disease. So in a matter of 3 or 4 minutes, the student will be able to grasp the key, high yield exam relevant points of hematuria from this book. Similarly, another important topic is classification of the nutritional status. I will go to the 21st chapter on nutritional requirements and malnutrition. So in this section, we talk about assessment of the nutritional status. We talk about the ABCD method, anthropometry, biochemical parameters, clinical examination, and diet history. But again, what is most important for exams is how to interpret anthropometry. So for children above 5 years, we use BMI for age, and this is the interpretation of BMI for age. For children below 5 years, we use the WHO classification, which is based on weight for age, length or height for age, and weight for length or height. Based upon the Z scores, the nutritional status is classified as normal, underweight, stunted, wasted, and when the head circumference is less, it is microcephaly. So again, we have just 3-4 minutes of reading to be able to answer all MCQs related to classification of nutritional status. With this, I come to the end of my presentation about the key features about the book. I hand over the podium to Mr. Shukla. If there are any questions, I will be happy to answer them.
So, ma'am, thank you. Ma'am, also would like to ask you that, now we're showing this book, the chapters which we have discussed today on this platform of, which we have introduced from Lippincott, which is Lippincott Medical Education. So I hope how the experience so far. I believe you must have started, using this platform more often, and started taking some of the classes that you may be taking, the children and all. I hope the experience of the platform, I think, is quite good for you.
It's amazing. Like I said before, I'm expecting this to just transform teaching and learning. It is a useful resource, not just for students. It's going to be so useful for faculty to prepare for their classes, to set question papers for their students, to give them examples. It is, I think somebody is going to demonstrate the features, isn't it?
Yes, ma'am. I think we definitely have an expert with us.
Sure. So I think the participants will be very, will be very keen to know how beautifully this platform works. But when I was introduced to it, I am not very fond of technology. So I was not very enthusiastic at first, but then the features are amazing and it is so easy to learn. It's all intuitive. It doesn't require too much of mental energy to learn how to use the platform, and it saves time, it saves effort. Everything which I used to do as a student with paper and pencil, I'm able to do with this platform in half the time. So I think students will enjoy using this platform. We are looking forward to having the demonstration.
Sure. Thank you, ma'am. Thank you so much for your words. Now I request Dr. Sahil, who can actually, take us through this platform itself and show us the unique features which are AI powered, USS seamlessly, very easy, for students and faculties to adopt. So Dr. Sahil, over to you.
Thank you, Ravi. Thank you, Dr. Padmasani, for taking us through and enlightening us with your thoughts. So, as ma'am mentioned, I will be taking you through our Lippincott medical education platform, how AI has revolutionized the way we used to read or understand text in our time. So I myself being a doctor, so how we used to read how books and then interpret understanding and learning, how LME has transformed the medical education with this new platform. We call it as Lippincott Medical Education. I will be taking you through BRS Pediatrics itself. Having set up the context by Dr. Padmasani, it will be easier for us to understand. So we'll be leveraging the same book for our session today. So taking you through to the session. So this is our Lippincott medical education platform, which you can see. And for today's discussion, we will be referring to Dr. Padmasani's textbook, that is BRS Pediatrics. So if you could see on the Lippincott medical education platform, I just clicked on a particular book, that is BRS Pediatrics, and the book has actually opened up for us. And for on this page, you can see there is a lot of text mentioned. So what it helps us, we being doctors, and we have now seen that the current medical education curriculum is designed in such a manner that it actually requires stimulation of learning. So which is basically attempting lot more MCQs. So which are not only essential for understanding but also to clear examinations. So you could see I have opened up any random book, a random page inside the book, and by clicking on this icon, which was actually visible while Dr. Padmasani was also referring to, and I've just clicked on one of the options which highlighted as pages Q&A. So the minute I will click on Q&A, it will automatically generate MCQs for us. So if you could see, I opened up a random page inside the book, and this can actually happen for any book which is actually there on the platform subscribed by the institute. So for today's discussion, we are referring to BRS Pediatrics. So I've opened up any random page, clicked on MCQs, and automatically MCQs have come up on our screen, which definitely I would request, I will take a requesting audience to just take a guess on one of the MCQs being displayed. So what is the incubation period of filariasis? So if anybody guesses it, so maybe option A, and we can check. So it will let us know the right answer. Maybe the second question, what is the drug of choice for filariasis? So it will actually take you through till we get the right answer. So once we click here, it will let us know, it will allow us to attempt the question till we get the right answer. So while talking about BRS Pediatrics, it itself has MCQs given in the textbook, but our platform, the AI power of our platform actually allows to create custom MCQs from every given page in the book. Other thing which it allows is, again, on any random page, I have clicked on study notes. What it allows us to do is to create notes from the complete page which has opened up for us, which means quick revision. Whenever we need to sum up anything, we need to answer any question in a Viva, and we have got very less time. So here it comes, notes. I have clicked on notes. Automatically, the notes have been created for us from the page in the book. So that goes what Dr. Padmasani was referring to. It makes our life lot more easy. Back from our medical school days to what we are seeing over here, it has actually revolutionized our learning. Now it doesn't end over here. It has created notes for us. What we can do more over here is we can even add YouTube links or any video links from outside the platform as well, which means it doesn't limit our understanding and learning just from the books which we have on the platform. It also allows us to collaborate, include links, include maybe journals, maybe books from other publishers from outside the platform as well, which means it is not limiting our understanding just from our books only. We can always leverage links, notes, books outside the platform as well. So maybe I have just gone to and I just YouTube, I have copy pasted a link, mentioned the text, and inserted it over here. And you could see so how this note section can actually build up for us, and we can actually share the same with our groups. So if we have any group which is with us created, we can just click over here and it automatically gets saved and shared among the group. I will also take you through the groups where all information is getting collated. Next comes summary part. So it also allows you to create summary. So we have seen bulleted notes. It allows you to create summaries as well. Again, just click on the button, the summaries get created, and then again it can be shared in your default workbook, or you can share it with the groups as well, which you can create at the touch of a button. I will take you through. So next is something like a read aloud. It in fact also allows you can just set the text and it will read the text for you. So any text in the book can be put to read aloud as well. Other thing which it allows is, so if we just click on our text, select a text, it allows you to create note. It doesn't stop here. What it allows you to create is, we can just copy paste a YouTube link. It will automatically come over here. And that is the best part of it, because anything external, linking, collaboration, it actually supports, which is actually very important for our medical education, because it is very much evolving, and it is just not limited to books on the platform. So again, it can be saved. So I just highlighted a note and it included a link from YouTube, and we can save it as well. Other thing which it allows is even translation into local languages. That is also there. Read aloud is there. So translate, as I mentioned. So it even allows you to translate into local languages. And then there is something called as if we go back. So this is all about the book, what we can do in a book. And then there is something called as workbooks. So you see, whatever we have done today in the book, it automatically gets saved under the workbook section. So you see, we did a note making section. We included a link from outside. It comes over here. Then you could see we created some notes. it is automatically coming over here in the default workbook section. In fact, if we have created any group, so if you see, if we have created any group, it automatically takes you through whatever we have done and shared with that group. So you could see in one of the notes, I have shared it with a group which I have created, like MBBS first year over here. So creating a group is also very easy. So you can just create a group. You can name a group, say MBBS fourth year, it gets created. And now anything which you are doing, and any, all the peers and colleagues who are part of this group gets access to anything which we share with the MBBS fourth year group. So you can even edit members, you can even add members by just adding their email IDs. So that is how our platform supports learning, collaboration, not only among you, with you, only you can do it, but also among peers and colleagues. So faculties can create groups, students can create groups, they can save what they are doing in the form of links, journals, books from outside, they can create notes, and this is how your library would look like on the platform. So Lippincott medical education currently is B2B, which means institutes can access Lippincott medical education. We have got more than 300 books available on our platform, and all the features which I have shown you, AI features, note making, collaboration, making groups, regional language transformation, everything is possible with all the books which we have on the platform. So this is about Lippincott medical education platform and how we can access books on the platform. That is it. Thank you.
Thanks, Sahil. Thank you so much. I think it was a quite a detailed, a demo that you have provided. And in fact, there are certain questions which are now popping up on our screens, like, on the panelist link that, what are the costs and also. I think you fairly mentioned that it is more of a B2B, platform that we are offering to. And in fact, recently, just to tell all attendees that we have shared a link, for our survey or the feedback of this webinar, and also the feedback of the platform itself and the information shared by Dr. Padmasani. The thing is that we are offering demos and free trials to all the institutes who are willing to, and allow us to provide the trials. So in fact, if you look at the feedback form, we have given a place wherein you can actually mention whether you're interested to get the demo for your institute or not. So please fill the feedback form. And Subhashi, if you can just help me to get any question that we may have on the chat section and the Q&A section, please.
There is no specific question on the chat or on the Q&A related to the ebook other than the cost itself. So I think when we roll out the feedback email, we can also state if they are interested to know about the cost or more about the product. They can reach out to us directly on an email, and we can take this conversation offline. Other than that, I would like to encourage and put a note out to everyone, every participant here. If you have any question for Dr. Padmasani, we still have a little time in hand, and I think she can pick up a few questions. If any of you would like to ping on the chat, and we'll be able to take it forward. In the meantime, let me also tell you, if you have questions further about this book, the chapters of this book, if you're interested to download the TOC, please do write back to us. We'll be more than happy to give you answers back from Dr. Padmasani. We will be keeping on hosting such webinars, so we would like to invite ma'am and thank her as well for this session and invite her for the future sessions. It was such an enlightening session for all of us, and I hope the participant had a good time listening to her to very insightful chapters that she spoke about. Over to you, Ravi. If I have any questions,
Yes. Thanks, Subhashi. Thanks, ma'am. Thanks for coming. I believe you have come. You have all the way, like on the leave in the last 5-6 days, and you have just came back from your leave, and then you are just delivering the the information that we actually wanted, and that wanted by the students also. Thank you so much, ma'am, for joining us today. I think we are right on time, Subhashi, and other attendees as well. So thank you very much for joining for this session. I think this is just the beginning. that we're going to have much more sessions like this in the coming future. So please we'll be keep on posting you all that sessions in advance, and all thanks to our student ambassadors that we have across the country who actually help us to generate,
Spread the word.
bring more people onto the platform and spread the word. Well, again, thank you so much for joining, guys. Wish you all the best. Happy weekend.
And
Good
please
evening.
do fill up the feedback form. We
Yes,
would
that's
look
very
forward
important.
to your recommendations and your insights on how you feel about this session. Thank
Yes,
you, ma'am,
so much.
once again for your time, and it was so amazing to have you on our webinar today.
Thank you, Subhashri. Thank you, Sahil and Ravi. Thank you all very much.
Thank you.
Bye.
Happy weekend,
Thank you.
everyone. Thank you.
Thank you so much.